Okay, well, everyone, thank you for joining us. Good morning, good afternoon, good evening, wherever you're calling in from. Welcome to International Medical Corps' year-end global briefing. I'm Rebecca Milner, International Medical Corps' Chief Advancement Officer. Thank you so much for joining us today. We appreciate the support that so many of you on this call have given us over the years, particularly our responses this year to natural disasters, such as the earthquakes in Morocco, Syria, Turkey, and the flooding in Libya, and to ongoing deadly conflicts, such as Israel, Gaza, Sudan, and Ukraine. Your support makes it possible for us to save and change lives around the world, and we're so thankful that you're part of the International Medical Corps family. I'd also like to welcome members of the Washington Global Health Alliance today. Washington Global Health Alliance is one of our partners that shares our goal of improving global health outcomes, and we're glad to have you with us as well. We're going to keep today's briefing as efficient as possible. We'll wrap up in about 45 minutes. Toward the end of our conversation, we'll take questions from the chat. So as we talk, please feel free to type in your questions and we'll do our best to get to them. I'm very happy to welcome two of our colleagues who will share updates on key humanitarian crises and discuss upcoming challenges for 2024. First, let me introduce Dr. John-Kall, who during her long career here has worked in more than 18 countries across Africa, Asia, the Middle East, and Europe. As a senior health advisor, she provides support for our in-country teams and regularly deploys to our missions to provide training and capacity strengthening, as well as support our emergency responses. We also have Dave Eastman, another longtime member of the International Medical Corps team, who is Senior Director overseeing our operations in East Africa and Asia, which that region includes some countries that are experiencing the world's largest and most complex humanitarian crises. So welcome to you both, and thanks as always for the work that you do. The terrorist attacks in Israel and the war in Gaza and the worsening humanitarian crisis are at the top of all of our minds. In Israel, where we do not have an ongoing presence, we are currently supporting our longtime partner, JDC. We are helping to ensure children and vulnerable people in Israel have access to mental health services and are helping affected communities recover and rebuild. In Gaza, where we have operated since 2008, we currently have a team of about 70 people there. Conditions on the ground are incredibly fluid, and as conditions permit, we are providing medicines and supplies to healthcare facilities, supporting our partners, and deploying a field hospital. Let's start with you, Jill. Can you give us an overview of the humanitarian conditions on the ground in Gaza?
Sure, Rebecca. Hi, everyone. Thanks for having me. So since the start of the conflict, there have been about 1.9 million people displaced, which is about 85% of the population. And with that many people displaced into a much smaller geographic area, with the destruction of already weak water and sanitation supply systems, and the overcrowding and unhygienic conditions, there's always an increased risk for communicable disease outbreaks. So like respiratory tract infections, diarrheal diseases like cholera or dysentery, and even skin infections like scabies and lice, among others. So just to give you a sense of how things are going, so far we've seen more than 130,000 cases of acute respiratory tract infections, nearly 95,000 cases of diarrhea, and with the cases of diarrhea in children under 5 years old at about 20 times the usual number from the same period in 2021 and 2022. There's more than 29,000 cases of scabies and lice, 3,000 cases of chickenpox. There's also 1,100 patients that are in need of life-saving dialysis. And of course, there's 52,000 pregnant women and 5,500 babies born just in the last month. So, and in addition, only 39% of the hospitals are even partially functioning. And even those hospitals have a severe shortage of medicines and consumables, and the lack of equipment ranges from your stethoscopes to X-ray machines to provide even most basic medical services. And also many of the 1.9 million people that are displaced are healthcare staff, including our own IMC staff. So not only do they not have healthcare facilities to work from, but they've also lost their own homes, they've lost their loved ones, and they also need assistance, just like most of the conflict-affected populations that we serve. So many health staff are also trapped inside the remains of their hospitals with their families where they were sheltering. And all of this is just to highlight the desperate need for additional medical staff. And we also have to remember that currently Gaza is an active conflict zone with constant shelling. So our team has to monitor their own operational safety during their working hours and also when they're not working. So initially, our team was actually staying in the compound of a shelter, not even in the compound, but on the outside. So they were exposed to the shelling as well as the elements. So we're trying to rotate people out because the lack of sleep, the stress of just hearing the airstrikes all around you, much less the fear that you might be hit in one of those airstrikes, all of this just kind of speeds up burnout exponentially.
Mm-hmm. Well, and I think you made the point that when you were talking about a lot of these ramifications, the health ramifications of this. I mean, it's things that in daily life wouldn't be a problem otherwise. People would be able to access this. I mean, as you said, mothers are pregnant, babies are being born. I mean, under these incredible conditions, it's very difficult. So how is International Medical Corps planning to respond? I mean, maybe you could talk a little bit about that.
Yeah, so IMC is addressing these issues by providing medical supplies, equipment. We're providing staff. We're also providing training when we can. And even we're kind of supporting infrastructure in the form of a field hospital. So our field hospital is a self-sufficient health facility with its own water and electricity supply. It's staffed with a team of more than 20 personnel drawn from our own emergency roster of trained professionals. And that includes clinicians, biomedical engineers, water and sanitation staff, logistics staff, and security staff, among others. The hospital will have a 6 to 10 bed emergency room, 20 beds for inpatient management, an operating theater, a level 1 intensive care unit with 4 beds, X-ray, ultrasound, laboratory, blood transfusion services, etc. So we will be able to provide medical and surgical services for adults and children, anywhere from outpatient care to triage, first aid, wound care. We can provide surgical care for trauma. We will be providing some immediate physical rehabilitation, advanced mental health services, and also we're going to be providing comprehensive emergency obstetric and newborn care, which is really, I think, one of our most important components, given the number of pregnant women and newborns who don't have access to the most basic health care.
Right. So, so we're expending a lot of time and energy on getting this field hospital into Gaza. I mean, why did we choose that route? I mean, what makes this a little bit different than some of the normal responses where we support existing health facilities?
So that's exactly the point. So I think in other conflicts where we kind of work with the government and we support what is existing already, and we just kind of support the gaps. Right now, the gaps are so significant that we are supporting the conflict-affected population by almost replacing what they had. So if they don't have hospitals, then we're providing a hospital. They don't have healthcare staff, we're providing that. They don't have medicines, we're supporting that. And the other thing I wanted to touch upon was also to, our teams that are going into Gaza, to better prepare them for seeing patients in Gaza. We also recently partnered with Primary Trauma Care Foundation to provide primary trauma care training for IMC staff in Jordan who are deploying with our field hospital. And we also provided the same training for staff from the Palestinian hospital in Cairo because they'll be seeing patients that are coming out of Rafah. And this training, focused on basic life and limb trauma care through teaching essential immediate actions that save lives and prevent disability. And there was a lot of practical hands-on training using mannequins at these skill stations. We also piloted a neurotrauma component for generalists. I think everyone knows that most, non-specialists don't get training or they don't get too much training on head injuries. And yet in conflict situations, they're very likely to see these kind of patients. So that's something else that we're looking to continue along with maybe a pediatric trauma component, to best prepare our frontline healthcare workers for what they'll experience in Gaza.
Right. So as we're doing everything we can to get the field hospital in and set up, like we have an advanced team that's already in, and they're, viewing or, determining the potential sites and working through all of the bureaucracy to get the field hospital in. We're doing that training so that people are ready, right?
Yes,
right when they go in. Yeah. Yeah. Yep. Well, I mean, as the team, makes progress, I think our main goal is to see our first patient before the end of the year, and we'll keep all of you on the call and all of our supporters up to date with how that's progressing. But we don't want to. But there are a number of emergencies across the world that need our attention. And, another global crisis that we're facing, of course, is Ukraine. I mean, the war continues to grind on, and it's close to entering its third year. I'm sure everyone saw the news this morning that ballistic missile strike was on Kyiv today. There's continuing attacks on civilian infrastructure, including healthcare facilities. And International Medical Corps is, continuing its work to ensure continuity of care throughout the country. And because it's such a complex environment, our strategy in Ukraine is kind of multifaceted, right? And our response is customized to the unique needs of each region. And maybe, Jill, you could kind of elaborate a little bit on that and talk a little bit about how our 400 staff there in Ukraine are kind of approaching this kind of third year of conflict in the winter.
Sure. So, we have to keep in mind that Ukraine is the second largest country in Europe. So the way that the war is being waged is different from region to region. So, of course, the services that we provide in country, combined with the strength of our local partnership and technical capacity, it does enable us to adapt and respond as needed. So, for example, our general response activities include provision of health services, provision of medical supplies and equipment, mental and psychosocial support, protection and gender-based violence activities, nutrition, including care for new mothers, also non-food items and multi-purpose cash assistance, and of course, strengthening water and sanitation and hygiene. But it does depend on where you are. So, for example, in the active conflict zones along the south and southeast borders, we focus on critical life-saving operations, including supporting frontline hospitals with critical equipment and supplies. We also help affected communities by distributing food, non-food items, such as winterization kits, where they have blankets, socks, all of those kind of things that you would need in Ukraine. And imagine, if you can imagine, the harshest winter that we have here in the US is still nothing compared to what they face there. And we also provide hygiene supplies and water. And then in the areas that are under threat of attack, which is mostly in like the central area of the country, we provide communities with mental health services, wash services, nutrition, non-food items, and cash assistance. And we also help the existing healthcare facilities prepare for and build resistance to potential attacks and mass casualty events. Excuse me. And then in the areas further away from the fighting towards the west, we focus on the needs of like the internally displaced people. Excuse me. By providing, mental health and protection services and those kind of things, and supporting what already exists there. And then throughout the country, we focus on, training clinicians, first responders, in areas like emergency and trauma care and psychological first aid. And, I'm kind of looking at all the challenges that we've had, but we've still been able to reach more than 9 million people since the invasion of February 2022.
Yeah. And the team has done an incredible amount of work. And I think for 2024, one one of our priorities is physical rehabilitation, right? Because there are so many war injured, yes, people, and that's like the need has just dramatically increased, but there was maybe a small group of health professionals that had been trained in that. So maybe you could talk a little bit about sort of our plans for 2024 there.
So I think in 2024, with the government of Ukraine, because they also want to shift a little bit from not just emergency response, but they're also trying to kind of rebuild their country. Because not giving up the fight, et cetera, et cetera. So we are involved on two different levels. One is furthering health reform. So before the war, they were already in the process of kind of reforming their health system. So that's something that we'll be partnering with them and working on that. And then just to go back to what you were mentioning about physical rehabilitation, that's a specific area that the government does want to work with. And even our government is supporting that. I think physical rehabilitation is something that is not necessarily in the mainstream of humanitarian work, but it's definitely needed. And we've seen that with all the other crises that we've had in recent years, from Afghanistan to Syria, now in Ukraine. And there's just not a lot of organizations that are actually providing that service. So that's what we're going to be doing. And the benefit of kind of our method of service provision is that we link physical rehabilitation with mental health support. Because I think that's really important. If it's a new disability that you may have an amputation, those kind of things. And it's hard for the patient as well as the caregivers and their families. So our mental health support is not just for the client, but it's also for their families also. So I think that's something that we offer that I don't think a lot of other people are doing.
Right. And I guess the one of the hallmarks of International Medical Corps' work, I mean, regardless of where we are, but it's a particularly great example in Ukraine, is really to support the existing health system, right? And it's really about, I mean, there's a lot of capacity in Ukraine and a lot of, and really what we do, to your point that you mentioned earlier, is we identify gaps and then we support to fill those gaps and then to transfer those knowledge and skills to the local health system. And I think that the team in Ukraine has done an incredible job there.
Yeah, definitely. Yeah.
Mm-hmm. Well, Dave, I mean, just to look at another kind of ongoing conflict that's just as brutal but hasn't been as much in the headlines and is not as much top of mind is the crisis in Sudan, the conflict between the government forces and the main rebel group known as RSF. I mean, the civil war, I mean, the scale is so significant. I mean, it's displaced more than 6 million people, taken like 70% of the country's hospitals out of service. And it's particularly, I mean, the situation is particularly grim and dire in Darfur. Can you talk a little bit about what's happening there and why we should be paying more attention?
We certainly should be paying attention because so many people are affected in a huge country. To give you a sense of how big it is, from the east part of Sudan on the coast of the Red Sea to the westernmost part where I worked for a year in Mukjar in West Darfur. Mukjar, if you poked a pin in it, would be dead center of the African continent. That's how big this country is, and nearly the entire country is affected by war. It was already a difficult condition in Darfur. A lot of people live in villages with mud huts with thatched roofs that catch fire and are flammable. They're living under very simple conditions, all the way to the cities that you saw in conflict around the airport in Khartoum and other cities. So the level of destruction and suffering is really just huge. But what's also difficult about Sudan is it's hot. It's hot in so many ways. It's violently hot. To move things, you need to find air-conditioned units for your drugs and medicines to make sure they're safe. But it's also hot. It's difficult to work there, and it's open conflict, and your goods might be stolen while you're moving them from your warehouse to the city that needs it. So it's an extremely difficult context where also you're working with two different authorities to get access to places and try and move those things and continue the services as we have been since tax day of this year when the war broke out.
We'll talk a little bit about some of those logistical challenges. I mean, I know that the team initially had sort of started, I mean, because the conflict erupted in Khartoum, they had to quickly move themselves and the team, right, down to Port Sudan, right, or Madani, and start a logistics hub there. But then with the crisis sort of, really heating up in Darfur, we can't get things all the way across the country, right? So talk a little bit about some of those challenges and how we've tackled that.
It's getting harder and harder to get things all the way across the country. We do what we can as we can. Before tax day, Sudan was a place where humanitarian organizations worked from cities and hubs and worked out to the rural areas to support people. All of those cities became flashpoints. And so a lot of the places where we had offices or clinics or offices with government were looted, destroyed, burned. People were put in danger. We had to notify our donors in a letter of all of the offices that were looted and people injured. And unfortunately, some people lost their lives. It was a very long letter. It's been a really challenging year. And despite that, having to move to the east to a city of Port Sudan, and then finding our way back towards where displaced people had settled outside of Khartoum in a town called Madani and Sana'a. We actually ended up maintaining our services, but also adding services in new areas. So we were in 5 states. Now we're in 8. And we sent a rapid response team to Khartoum and working to hire and establish health services there, which is also extremely difficult. While it's also a conflict area, finding qualified people and setting up services again, which in a city where before I was jogging around the airport, the same airport that you saw getting shelled and bombed. Right. So completely new situation, but the needs are the same. We still need to provide basic health services, basic nutrition for mothers and children, reestablish water points, reestablish places where they can safely store their medicine so that they can provide those own services. We're still working with the Ministry of Health and in over 60 facilities. So providing incentives, still trying to provide training, providing oversight from our staff who are in those flashpoint areas and getting them supplied and getting information out. Sometimes you can't reach them by phone. So sometimes they have to, work in islands of safety. So it's a really, really challenging situation.
Right. Well, and then from one complex emergency in Sudan to another complex emergency in Afghanistan, where we were founded almost 40 years ago. I mean, Afghanistan, it's just a crisis after crisis, right? 3 earthquakes, quick succession in October, a lot of economic and political turmoil. And then the latest of the influx of Afghans who have been living in Pakistan as refugees for many years, but now are returning home because they don't have the proper documentation. I mean, many of these people have never been in Afghanistan, right? But they have to head home with very few possessions and are really returning to a country that they don't know of in the middle of winter. So maybe you could talk a little bit about how we're addressing these sort of crisis within a crisis, and then and how we're continuing our operations there.
Well, this is a perfect example to say thank you, because as you mentioned, the earthquake in Herat, we responded with funds that, donations from private individuals. The team in Afghanistan said, we want to go. They did it in collaboration with the authorities at the request of the authorities, and they responded to provide winterization kits, and they provided training and psychological first aid. The response for these refugees coming back from Pakistan, we were able to provide medical services very quickly with private funds. And so that kind of flexibility and responsiveness builds trust with the communities. It enables us to maintain our presence in a situation where a lot of organizations are held in suspicion. But we have really good relationships because we have never stopped working in 40 years, because we are primarily an Afghan organization. It's almost all Afghan staff. Because even though, there was an edict last Christmas Eve, Rebecca and I remember well, that was our Christmas Eve dealing with that. We managed to continue our services. We didn't stop. We found a way to keep it going. And in time, all of our female staff were able to return to the offices. In a year, I have some statistics that I think are pretty impressive. We served 1.5 million people in the last 12 months in 40 primary healthcare centers, in 1 general hospital, 8 children family social centers, 13 psychosocial counseling centers, 17 women-friendly health spaces. We constructed 28 water supply networks, all in this context where some organizations, are really struggling to maintain those relationships. So, and that's really also thanks to the quality and the experience of our staff there in country.
Right. Incredible team. They are really accomplishing quite a lot. And from challenge to challenge to challenge, I mean, let's just touch on Libya a little bit. I mean, from last September, I mean, one of the most shocking kind of natural disasters that was splashed across the headlines was Storm Daniel, right, which was a metacane, which they call these cyclones in the Mediterranean, right? It dumped months worth of rain onto this northeast coast of the country, right, in a matter of hours, right? And so the torrential rainfall caused 2 dams above the city of Derma to collapse, sweeping like a quarter of the city into the Mediterranean and destroying much of what was left behind. I mean, it's not an easy country to work in. I mean, we've been there since 2011. We weren't in that area when the crisis struck. So maybe you could talk a little bit about how the team mobilized the response and what conditions are there, what it's like there, 4 months later.
This is another example of our team saying we've got to do something. I was at a parent-teacher conference and I got a call from Talal Bernaz in Libya saying there's been a flood. We'd like to respond. Again, private funding enabled us to get in the car. We were among the first organizations on the scene because of our strong relationships and the trust. We were the first organization inside Derna or able to respond within 4 days. We established 4 EMT type 1 fixed hospitals. The government asked us to support their psychosocial hotline. So we have mental health counselors working on their national hotline. I think as of last month, we'd answered something like 1,500 calls. Some people asking just for, advice, some people really needing help. And we're still there, even though other organizations are sometimes having trouble staying inside Derna, because we have that trusting relationship, because people respect the fact that good quality healthcare is necessary and needed. And we're also working in the areas around that. So there are displaced people, 5,000 people in another town. So we're providing, water trucking, disinfection kits. We're supporting displaced people in other cities. So, it was a fast response. It was a trusted response, and we've been able to continue to help the rebuilding.
That's great. Yeah. Well, if any guests on the call have a question, please type that into the Q&A box. We did get one question, Jill, about the field hospital and how we're going to supply electricity and water to the facility. If we're bringing in a full facility, how are we connecting to those 2 critical pieces?
Sure. So I think and we've done this in other countries, so I think we're pretty well versed in it. But for electricity, we would bring in a generator as part of that package. Fuel will be an issue because there's not going to be fuel available in Gaza, so we'd have to bring that in. We will work with WHO and the logistics hub and all these people to help make that like a safe transfer. So we'll use our generator and fuel for electricity. And depending on where we are, we will have to truck in water. From my time of actually being in Gaza, the water in Gaza is not great. So I think just for patient safety, we would have to initially truck in water until we would be able to find.
Well, I think actually, hasn't the team purchased the reverse osmosis machine?
Did they? Yeah. Okay. Yeah. I was away, so I didn't hear. Yeah. That's great.
Yeah. So we would have the capacity to generate about, I think, 10,000 liters a day. Is that possibly right? Well, we can clarify that. But there would be the capacity for ourselves to be able to produce that water because, as you said, it's hard to connect, right, to the water source there. Yeah. And maybe another question for you, Dave, is, similar to Libya, a number of the countries that we're working in East Africa, are experiencing the impacts of climate change and a good example was recently in Somalia, where, after 6 years of drought, they had all this rain in just a matter of hours. Maybe you could talk a little about some of our kind of preparedness and training efforts to help these communities grapple with the sort of increase in natural disasters that they're facing, the drought and the rains and all of that.
So in these areas, we do work with local authorities to work in health centers and train health staff. We also will set up response teams, as we did in Somalia, to go out to affected areas where, it looks like something that you'd see in a Red Cross video, water up to people's waist flowing through a town, really, really difficult conditions. The kind of health work that we do is absolutely relevant in these situations. When there's flooding, people need healthcare. They need fresh water. Women still need care. Children still need nutrition services, and they still need, old people still need healthcare. When there is drought or lack of water, people still they lose their animals. They start to go hungry. They still need nutrition support. Families still need to find, medicines that they were used to having. All of these health services that we provide are still very, very relevant when you see the impacts of climate change and disasters, flooding, forest fires, earthquakes. There's still a need for healthcare immediately and to cover for that until services are able to recover.
Yeah. I think one of the important things is to view, with all of the impacts of climate, I think that one of the important things is to view delivery of health services as a key component of resilience, right? So if you're not healthy and you're not going to be able to recover, right? And so it's a downward spiral if you don't. And so really, as we look at the impacts of climate and we want to help and make a difference, I think one of the ways that people can do that is supporting direct health services, right? And strengthening health systems, because those people are going to be on the front lines of these climate disasters. So just a thing there.
And to keep communities alive. Right. When you talk about resilience, a community is resilient when they don't have to move or leave or lose half of their population. So to provide those services until they can recover and continue and maintain their lives that they had before and rebuild their schools, whatever was happening before, that's real resilience.
Right. Well, as we kind of look forward to 2024 and you kind of look into your crystal balls, Jill, maybe you can talk a little bit about some of the things that are at the top of your mind and what areas that concern you the most.
While I think that Gaza and Ukraine will still loom quite large, I'm also concerned about areas in Africa, not only due to ongoing conflicts like in Tigray and Sudan that Dave was talking about, but also lower level chronic conflicts in other countries. And those, I think, will become a little bit more complicated as China and Russia make more inroads into the continent. We'll certainly see more climate related displacement globally, like you were saying. In 2022, I think there were 32.6 million people worldwide that have been forcibly displaced by floods, windstorms, earthquakes, droughts. And the other thing that I've recently become a little bit more concerned about is that more and more, I think people are confusing governments with people, and in all the countries that I've worked in, just regular people, when you talk to them, are pretty much the same everywhere. So we all want the same things. We want job stability. We want good school for our kids, a safe neighborhood to live in, accessible healthcare, right? Because without accessible healthcare, you can't really do anything else if you're not healthy. And so I think forgetting the difference between political agendas and regular people really kind of dilutes our humanity. So that's definitely something that I would be concerned about.
Right. And Dave, as you look forward to the next year, what are some of the things that you're keeping an eye on?
Well, when you have conflict or disasters, markets get destroyed. They get washed away. They get burned down. They get blown up. Or people lose access to markets. When we had the flood in Derna in Libya, people had to drive a half hour to go even get the most essential basic items in the beginning days after that flood. So And when there are these catastrophes, it's very hard to have farms and to have supply chains so you can sell your farming goods. So in Sudan, for example, we're really concerned now about the long-term effects of Sudan, which was kind of a breadbasket and a market hub for East Africa, being disrupted for so long. So what are going to be the effects on South Sudan, on Chad, on other countries, and also on their economies? So it has a knock-on effect, as Jill was saying. Everybody wants a job, everyone wants stability, but there are going to be these knock-on effects of conflict and disaster on that stability.
Mm-hmm. Right. Well, one of the questions that our guests have asked is really explaining how we mobilize quickly when these emergencies happen. And maybe, Dave, you could talk a little bit about how we all come together and respond. And then Jill, you can kind of chime in with any additional things that you wanted to say.
And so International Medical Corps is a bit of a family because we have no boundaries. We call each other all the time, 2:00 in the morning, 7:00 in the morning, midnight, because we're all over the globe and disasters happen at the weirdest times. So we will receive a phone call or an email or even a text from someone in country saying this is happening. We would like to respond. And my first question back to them, whether it's a text or a call, is what do you have in your pocket? Who can go and how can you get there tomorrow? Mm-hmm. Let's not think about it. What can you do? Just as if you saw your neighbor's house burning down, you just say, how can I help? And do what you could. That's the beginning. And because we are a well-structured, well-resourced organization, we usually do have some medicines and good health staff and some good jeeps on hand. And we usually work in remote areas. And so we are able to get there within a day with some really substantive help. And because we work with local partners, government authorities, we have partners that we can say, hey, we're here. How can we help? How can we start, donating supplies? How can we work with you in your clinic or whatever the situation is? And by the end of that second day, we are working. And that then we put out the word. We're here. We're doing something. And we start talking to other partners or other contributors. We start bringing more staff. We start seeing how we can bring people either from other parts of the country or internationally, seeing how we can get them in if we can. A great example from Ukraine is that our current country director in Ukraine was the country director in Afghanistan, and he was the country director in South Sudan, and you have staff in Ukraine who,
right.
Yeah, we all go all over the place. We learn from each other, and we're willing to hop on the plane. When the Morocco earthquake happened, our Libyan logistics coordinator had hopped on the plane to go to Morocco. 2 days later, he was going back to Libya because the flooding happened. So we're ready. We're flexible. People are very committed, ready to get on the plane. And because we have these resources, from private contributors, we have that flexibility that we don't have to wait a week or 2 weeks for the United Nations or, the American government or other governments to promise money. We can go do what's right. And then when they see it's being done, they want to chip in.
Right. Jill, did you have anything you wanted to add there?
No, I agree with everything that Dave said, including that we have no boundaries sometimes. But I do want to say, I think it is important to kind of recognize the value of contributions from individuals, not just governments, because that does give us the flexibility to be there as soon as things happen and to kind of start working immediately. And it also helps us to prepare to be able to do that. So, for example, like I was mentioning earlier, we're doing a lot of trauma training. So we are preparing people so that they will be ready to respond. And I think that really is our strength. And a lot of that is thanks to, private contributions that helps us, kind of strengthen and be ready to go.
Yeah. Yeah. Well, I mean, we've been talking a lot about the challenges that we faced and some of the difficulties in the countries that we work in, but we keep on keeping on, right? I mean, that's what we do. But maybe you could talk a little bit about kind of what gives you hope and what keeps you going when times get really difficult. Do you want to start, Dave, or Jill, whichever?
Dave, go ahead.
Well, it's working with good people like Dr. Jill. we enjoy working together. I think in this business, it attracts people who care, people who are intelligent, people who are problem solvers, people who are willing to walk through the mud, which is fun sometimes. Sometimes it's not. I think also, I think you'd have to ask anyone why they would try to do the right thing when someone else needs help. It just feels good. And when you are in a clinic and you see a mother with a child that's going to survive because you worked really hard to write a proposal, that's where it all comes together. And that I don't think you get that from other kind of work. I think in terms of having hope, I think that, with all the information that we have globally and access to it, we can be aware of a flood in a town in Libya, and we can throw our support behind it as quickly as we want. So keeping our finger on the pulse of things and being ready, as Dr. Jill is saying, having that training, having those resources there, and then keeping aware of things, we can respond really quickly. So, and hopefully prevent, maybe the effects of future floods in somewhere, where if we either help working with the government to be ready for that, or even working with communities to know how to respond to that, or even hopefully working with a partner maybe to reinforce infrastructure, who knows? We can make things better.
Jill, what do you say?
So I guess I've been doing humanitarian work since 2004, and I have definitely seen a lot of hopeless people. And I have felt hopeless myself many times. But as a physician, I usually lean on remembering the individuals that we help on a daily basis and the lives that we saved to kind of remind myself of why I'm in this line of work. I also think about the families and the communities and our absolutely amazing staff on the ground. And all those people might be a bit better off because they're learning how to be resilient and self-reliant in the face of so much adversity. But I think as things get a bit darker on a global scale, I kind of think about opportunities. So I think about how lucky I am to be in a position to help others, where I could have easily been someone who actually needs help, right? I think about what else we can do, not just to improve our clinical services, but to help people stand on their own, how to make people more resilient. So, for example, knowledge is something that no one can take away from you. So how do we provide that to indigenous populations in Venezuela, conflict-affected people in Somalia, women in Afghanistan? How can they use this information to treat pneumonia or deliver babies safely or prepare for floods in the most remote or war-torn areas where they actually do have to rely on themselves because no one else is there to help them, So I really think that even the smallest opportunities can reap the biggest rewards, and finding those opportunities is kind of what keeps me motivated, even when things kind of seem kind of grim.
Right. Wow, that's very inspiring, Jill. And I guess, also just to wrap up and acknowledge everyone on this call, I think your support and your commitment to International Medical Corps' mission, really gives us all hope. And so, thank you so much for joining us. Thank you, Dave. Thank you, Jill, for spending a little time with us to kind of share your thoughts and what we're up to. But just want to thank everyone for joining us today, wishing everyone happy holidays and a really happy and healthy 2024. So thank you very much. Bye.
Thanks, everyone.
Thank you.